Hi, everybody. Welcome to Mormonish. I'm Rebecca.
And I'm Landon.
We have a wonderful guest on today. The guest is not a cat. Many of you may be disappointed by this. No, but it is our friend Rory, and it's a picture of her amazing cat. So, how are you today, Rory?
I'm doing great, and my cat is doing great. She's happy to be here.
I know we thought, what if we freaked everybody out, didn't we, Landon? We're like, what if we said, you know what, we've had it with post Mormonism. It's just too much. We are starting a cat podcast.
You would love
We
that.
probably get more viewers, yeah.
More viewers and just happy viewers, nobody has angst or anything.
That's right.
The best way to process something is just hug an animal. I'm not kidding. Oh,
great.
it's great
This is
though.
why
No, I
I'm
love it.
mine.
We're kind of talking about a sensitive topic today, and that's why Rory has a picture of her cat. And before we started recording, we're like, oh, what should we use? This or that. And she goes, well, I have my cat. I'm like, oh yes, for sure. But then the picture was so cute, I almost can't focus because it's so cute. Landon, do you have that trouble too? Are you having trouble? Because
No, cats don't really affect me too much.
so says you. Somewhere out there, there's a cat that will affect you. I guarantee it. That's funny. And like Rory said, a really good therapy animal, right? And that is kind of what we're going to be talking about today. So I have noticed, and probably a lot of you have noticed too, in the last couple of weeks, there have been on social media, post-Mormon social media, several posts about missionaries, mental health, missionaries that are coming home, missionaries that their story kind of raises an alarm, raises concern. So I've been kind of paying attention to those, reposting some of them, and just kind of weighing in and reading the comments, because I've had missionaries. I understand. I mean, all of us have relatives who are missionaries, friends who are missionaries, and we know the mental health struggles that can be pretty severe. So when you read about some of these missionaries where it's taken a trajectory where you just don't want any young person to ever have to go, there's concern and you just wonder. So one of the people that reached out in a post was Rory, and she said, well, I was a mission nurse. And I went, what? Because we know the mission nurses exist. We know they're there. We know, like I've had my kids say, I'm going to talk to the mission nurse. I got bit by a dog or stung by a bee, but I don't really know anything about that. And so I'm like, Landon, this is going to be great. What a great resource. So we are just going to delve into the world of, first we're just going to have Rory kind of, tell us what she can about the process of how you even become a mission nurse, what qualifications, what all that means. And we're just going to have a conversation about that. Do you have anything to add, Landon?
I actually was kind of wondering because I can't tell obviously from the cat, but Rory, you sound younger. I don't know. Did you go as a couple or can you go as a single
Yes, you can go as a
person as a
single.
nurse or what's the requirements?
Basically, we know nothing. So
Yeah, we know
start at the
nothing.
This is all
beginning.
new.
We have no concept of what it is, which is a funny thing. And I don't think I've even ever seen a podcast or have it discussed of what exactly is a mission nurse. So yeah, consider us complete idiots and clue us in. How does this happen? Do you request it? Is it a call? I mean, just start at the beginning. We have so many questions.
Oh gosh, and I have like such a weird journey of how I became a mission nurse too, so it's gonna be fun. But I actually do know someone who was also a mission nurse. They're actually my roommate. We
Oh,
were mission nurses at the same time, but we didn't know each other at the time.
oh,
So
fun.
it's even funnier because we kept seeing our names. Like I remember their name from the emails. And I was like, oh. And so when I met him like after the mission, I was like, wait a second. I think I know who you are. So the way that I became a mission nurse, I did go in my mid 20s. So this was about like 9 or 10 years ago. So yeah, I'm a little younger than like a senior missionary. So when I decided to go on a mission, it was like always something that I had like planned because I was like, born in the church. It was just like a thing that you did. Um, but I didn't want to put off schooling before going on my mission. So I got my nursing degree first, and then I had a church general authority that was in my ward, and he happened to know one of the people in charge of the missionary health department. So he was like, "Oh, hey, like I know you want to be a nurse. I know like you are a nurse. I know you want to go on a mission. Have you ever considered like being like a mission nurse?" And I was like, oh, that sounds actually like right up my alley. So I kept pushing it off for like years and years, which is why I went in like my mid 20s instead of my early 20s. I wanted to make sure I had like my Bachelor of Nursing degree. I had finished all of my other schoolings just because I had a really good like gig basically at school that paid for everything. So it took a bit, but eventually the goal was that I would submit my missionary papers, and then the general authority would let his contact in the missionary health department know. And I had his email too, so I could just let him know when I had put my papers in, and then he would watch for them, and then he would pull it for one of the missions that needs a nurse. So not every mission has a mission nurse. And
Let me ask you this. They do have to be a nurse. Is that right?
yes.
They're
Yeah, you
not
have to
just
be
some
a
volunteer from
registered
the
nurse.
ward that has a first aid handbook and a kit. Okay, that's
Yes.
reassuring. It is somebody with
Yes.
a degree, with
We
some
do have
medical
degrees.
training. I had to ask because
I know,
sometimes
right?
people are put in callings where you're like, what?
You have no
I don't
idea
play the
sometimes.
piano. How am I going to be the ward organist? So that's good. That's reassuring. It is
Yeah.
somebody with background and a medical degree. Okay.
Yeah, both
I'm
me and my
actually
roommate, we both had our BSN, so our
Okay.
bachelor's of nursing degrees before we
Okay.
went.
I'm actually shocked that they would let a single young woman be a nurse. I mean, you're going to have all these missionaries coming in. I mean, they can't have their companion in there when they come to see the nurse, can they? It would seem like that would be, that the church would have a big problem with single sisters being in with the elders.
Yeah, that's we can get into that. It was very
Uh-oh.
interesting. So there are two types of mission nurses. There are like the like senior quote unquote missionary nurses who basically follow who are like older
Mhm.
and who follow like the senior missionary standards. And then there are the young mission nurses like me, my roommate, a couple of other people that I knew, who you are technically like a sister missionary, but you're also a mission nurse. And the mission president dictates like how much, like what you do basically when you get there. Like everything is under the mission president. So you
So
do
you
proselyting
might
and
be
missioning.
Oh,
proselyting
okay. Yeah, that's
and
what you
nursing at
said.
the same time?
Yes.
Oh, wow.
Yeah, so you like I had my own area, I had companions. I had sorry, I went to a Spanish mission, so like all the
Okay.
like mission jargon is like Spanish in my brain
Spanish.
first, so I have to like translate it. We had lessons planned. I wanted to say the Spanish version for that. We had lessons, I had investigators. Yeah, it was, but I also had like a smartphone that was like unlocked and I could do anything with.
Mhm.
And that was how like people contacted me and how I like emailed the area medical advisor and like the area mental health advisor. So it was like a whole thing.
So you're saying you could be in a restaurant, someone's choking. As a nurse, you could run, you could give them the Heimlich and then say, would you like to know more about our Savior Jesus Christ now that you're going to live and you've been so close
Now
to
that God
death?
is
Is
giving
that
you
you?
the second chance. Have you ever wondered
That,
why?
that's so funny. So it does sound like it would vary from mission to mission if it's all under the direction of the mission president, what
Yes.
exactly you were doing and how you were doing it.
Yes, it was all very different. The thing about like missionary health is it always defers to the mission president. The mission president is always the final say.
Interesting.
He's the one that dictates everything. Normally in the mission, it's the actually the mission president's wife that's in charge of missionary health. So if there is no nurse, then it's the mission president's wife who does it.
So,
So
so
the
you're
reason,
a registered nurse, 4 years
yes.
of college trained, but you have to defer to
A financial
the
advisor.
financial
Yes.
advisor or his wife
Who's the mission
Yes.
president? Yeah.
to
Yes.
make the decisions on health.
Yes.
Wow.
We were just advisors.
So I guess they
S-
assume inspiration
yeah.
that the mission president is receiving inspiration. No, the whole top of your head is swollen up. You don't need to go home or go to the doctor. I have inspiration. That's
Yeah.
interesting. I wonder, and maybe you'll tell us if you ever got into a little no, he needs this or she needs this. And they said, no, they don't. I mean, I'm guessing that would happen at some point in some
I
mission
assume
somewhere.
I was really lucky and had a really good mission
Oh,
president
good,
for most
good,
of my mission.
good.
And I and the last 3 months of my mission, we had a new mission president, and his wife started taking over the stuff, so I just like let her do it. I
She
pieced
had
out.
medical training.
No,
Yeah,
no, she didn't. No
no,
medical
yeah.
training. She was a
I
stay-at-home
know,
mom from
and,
Provo.
and I've had missionaries and I've seen that where they kind of treat it like, oh, we're his parents, that's fine. You have to have that kind of relationship there. But, oh, we're just going to tell him to do this. And I keep thinking, I wonder seriously what he's describing, if he needs more than, just a mission mom saying, do this. I wonder if he needs to go see a doctor, And I know eventually in my scenario, it did get there, but I was always like, that's nice that you're being so kind, like a mom, but it might need to go a little farther. So that is very interesting.
Yeah, so it's just so like the mission president is in charge of like, mission president stuff, but generally the mission president's wife is in charge of like the missionary health. So if something is wrong, they'll tend to call, at least in my when I was doing it, like I said, this was like 10 years ago. I doubt it's changed, but so the reason I was called to my mission was they were actually like the third or fourth mission president couple for that rotation. All the mission president couples before them had some really bad luck. So, like, they were not meant to be mission president and mission president wife. The mission president's wife had health problems. Like, they really needed someone to take over the healthcare part of the mission. So that's why they assigned to be there. So usually, just because obviously there aren't a lot of like missionaries who choose to go on a mission with a nursing degree.
Mhm.
So there aren't a whole lot of mission nurses, so they have to put them where they're really needed. So if there's a mission that's like doing pretty good, like I hope my mission was when I left because I set up so many resources to try and make it like self-sufficient. Um, then the mission president's wife can usually just take care of it herself. They do have access to a doctor and a mental health specialist. The doctor is called an area medical advisor, and the mental health specialist is called an area mental health advisor. There are not a lot of them either. So there are more area medical advisors than there are area mental health advisors. They're basically just doctors who they can, like area medical advisor was a gastroenterologist, which was
Okay.
lucky because we had a lot of those problems.
I bet Spanish speaking. Yeah.
Yeah, oh my gosh, so many parasites. So I went to South America. I'm fine saying that. So there were two area medical advisors for all of South America. So two doctors covering all the missions. They just split it basically in half.
And would you do
Um,
televisits then, I guess, maybe, or like through Zoom?
yeah,
Or
they
would
were
missionaries
mostly
travel to?
yeah, they were mostly there for to be advisors. So the mission president or the mission nurses could contact them and ask for advice. Um, since we're in a foreign country as volunteers, quote unquote, we were not practicing medical professionals. We are just advisors. So to do anything, we had to contact doctors and professionals within that country to do the things that we needed them to do, like write prescriptions or like diagnose or anything. The area mental health advisor did do telehealth visits. They were also a licensed doctor that specialized in psychiatry. Um, and I did actually have to visit with one of them once because I had undiagnosed mental health issues on my mission. So that was fun. I got both sides.
Wow. So you're like, I got to talk to somebody. This is
Yeah,
interesting.
and honestly, and I had access to all the medical notes, the medical charts for that area of the mission, so I read my own medical notes. It
Oh,
was great.
you're not supposed to read your own file. That's the
I
number
know
one
you're not
rule.
supposed to, but I unfortunately, unfortunately, the old system they had, you would sort by your mission and you would see everything from that mission with the most recent file first. And I was like, well, there I am. Now I know what the mental health advisor thinks of
It,
me.
Now you
is
know.
that common? I mean, did the elders have a choice and say, I don't want anyone to know that? I mean, in real life, outside the mission, your boss can't just go through your medical records. I'm guessing they make you sign some form that says that they can
Yeah.
have your records, but could they request that nobody know what was going on?
I don't remember signing anything.
I
I think we were
remember
just
in
relying
mission
on,
paperwork for my kids that it said, the mission president can see, you had to sign that the people who would need to know in the chain can
yep.
look at things. So,
Yeah, I
and the
assume it's
bishop,
just
I remember the
part
bishop
of
was
it.
on that list. And I was like,
Oh,
okay, so the bishop might even know before I know that there's some kind of an issue. And they may all be working it out before they even tell the mom, as like a last, the last resort. So yeah, that is an interesting. way it
Yeah,
works.
I'm not sure who had access to the system. It was a charting system that we used for whenever we had like, oh, so and so had this like blew out their knee or something.
Mhm.
And we would keep the charting in there. I know all the nurses had access to it, the area medical advisor, the area mental health advisor. I don't remember if like the mission president had access to that. I would assume so, but he never wrote in there because it's like a charting system that like you would use at a hospital, basically, just so we could be like, hey, here's like 10 entries showing like we did everything we could to like try and help with what we had, and like this is why this missionary needs to go home or like needs like I don't know, further medical intervention.
Right. So just kind of documenting it. So how does a missionary in your mission get in touch with the care that he needs? Does he make a phone call? Oh my gosh, my stomach, or does his companion call, or does the mission president say, I think he's having trouble? How does that work? Or does it vary? I guess maybe.
It definitely varies. So when I got there, obviously our mission president, like he'd never had a nurse before, so he was just like, I don't know, so here's a phone, and then if anyone needs medical calls, just call Sister Rory and she'll take care of you. But the problem was I was getting so many calls. Like I literally could not learn, like I couldn't take time to learn the language or do any proselyting because I was just dealing with medical stuff and it was like nonstop. So we had to implement some changes where basically they had to go through their gosh, what is so like the area leaders. So the elders had to go through the area leaders, and then the sisters had to go through I can't remember what their names are, the like senior
Sister
sister.
coordinators or something. They were sister coordinators when I was out. Yeah.
Yeah, those people. We had a
Right.
different name, but it was also in Spanish, so I don't
Okay.
know. The sister leaders. Yeah, sister coordinators. So they had to go through the two channels, and then I wrote up like guidelines of like, hey, these are the most common like illnesses and how you would treat them. Try this first. If it doesn't work, then they can get in, then they would be relayed to me. Um, so obviously some of my past companions would just call me directly because they knew me and they were like, whatever, she's fine. So so I got a lot of those calls. So usually they would just call me directly if they had like an emergency or a problem that they couldn't solve on their own. And then I luckily got in contact with a local member who was a doctor in my country, in that particular country I was serving in. And she was instrumental in helping me build an entire network of like clinics that we could like send them like each missionary to in each of their zones and areas. So I built a database that we printed out and put into each like member like missionary's house of like, hey, if
Wow.
you're in this like area, you go to this clinic. If for like this reason, if and then we had like a prioritization. It was really small mission, so we had like one major hospital that I trusted the most. And so if there was like a major accident or incident, then they went to that hospital. So we had this like whole system built by the time I left. I don't know if it's still there. I'm not in contact with them.
So
I
there,
hope
there
it's
was
still there. That sounds
there was
amazing.
no
I hope so.
plan. There was no plan in place when you got there for how to deal with this. I mean, I do jobs all over the world, and that's the very first thing we have to do is identify where's the hospital, where's the medical
Mhm.
attention, who do you call? That's a standard. I would think if you're in a mission that's been there for decades,
A
that they
while.
would have that already standardized, and everyone would know exactly where to go.
Yeah, they had like a booklet that before I got there, since the mission president's wife was like had health problems and couldn't do anything, one of the senior missionary couples that was serving there, they took over the health care for the missionaries. And what I was given when I was got there was they printed out like this medical healthcare booklet from the area medical advisor that just basically talked about like, basic first aid of how to deal with like common problems. And they were using that. And then they were the people that got me in contact with the doctor that I eventually started working really close with. Um, and they had like a sheet that had like certain hospitals and clinics on it. But there was no organized, like, if you are in this zone or in this area, you go to this hospital. If you need a prescription or something, you have to, like, we have a doctor that can write that. So, like, everything with that doctor was, like, in the beginning stages. So I think they were just like defaulting to the one major hospital, which from the furthest point of our mission was like a 5 hour drive. So if you have an emergency, it's like a bit far, but it was the best hospital.
Wow. Yeah, it does really seem to be roulette-like, you hear these
It is.
stories and then you hear somebody from the same area. I had nothing but positive experiences with my kids on a mission, having to, I got a dog bite or I got this, and everybody was good. They would call us, the mission secretary or, the mission president's wife and everything. But then I have friends who have horror stories like, oh, he was trying to pass a kidney stone and he went to the hospital and they said, go out on the street and buy drugs for your painkiller. I mean, just
Oh my
crazy
gosh.
stuff like that. So I
And
think it must
Oh,
just, there are probably stories in every mission where you're just like, oh my, I'm guessing in the chat right now, people are probably have some of those stories,
I'm
but
sure.
yeah. So was there anything that it was like, okay, send him home right now? Is there any, like you talk about the triage kind of where you go through
Yeah.
steps, if this, then that, is there anything where it's just like, okay, he needs to, or he or she, I should get and
Yes.
say that they must just go.
Yeah, we had um I had at least one missionary that had a full mental break. That was
Oh,
very interesting.
yeah.
So she was an instant send home, but we
Mhm.
had to hold her for a few days in one of the missionaries' houses. It was actually with like the sister leaders.
Oh,
And
wow.
they just had to stay with her 24/7. And the APs had to like visit and like try and keep her. It was a whole mess. And the reason we had to keep her for a few days was because we needed the area mental health advisor to escort her home. But the area mental health advisor was escorting another missionary home at that exact same
Oh,
time. So she was busy. And we only have the one for all of South America. So
oh my gosh. So
we were,
there is a person that's assigned to travel with someone that's having a mental issue back to the safety of their family. And that's
yes,
all
if
what they do. Oh my
Yes.
gosh.
And like she
Wow.
was also the one that like does like counseling and stuff if
Uh-huh.
because obviously at that age there's going to be a lot of missionaries who go onto the
Yeah.
mission with undiagnosed health
Yeah.
mental health issues like I did.
Absolutely.
So like we really needed the area mental health advisor. But they are not very common, which is why there was one of her I think she actually covered South America and Central America. Like there
Oh my
just are not
goodness.
that many of them. So she was very busy.
Wow. Just
Yeah,
flying
so
back and forth. Anytime
yeah.
somebody had to go, she had to fly with them.
If
Wow.
it was severe enough,
Yeah.
yes. There were certain situations where it's like, oh, like they're not at a stage where like I don't know if we can get them across the border when in the
Mhm.
state they are.
Okay.
If they're not at that stage, there's like no potential for harm or there's a small potential for harm, then like a senior missionary couple can take them home.
Oh, okay.
In these situations that she had to escort, it was like we have to have like a trained
A
professional go
trained.
with
Yeah,
them.
I see that.
So yeah, so there's different triage. I think there was actually a post in one of the Reddit about someone was talking about how their brother, I think, got escorted home.
Yeah, that was one of the ones that I caught. And it was like either I think it might have been nephew. The person was really
Yeah,
concerned and they didn't know what was happening. And as soon as they said escorted, either you or someone else waited and said, oh, it's very serious. If they're
yeah.
being escorted like that, it could mean
Yeah, I didn't
self-harm.
want to
It
freak
could
them out.
mean, yeah,
Usually
yeah,
if a senior missionary couple is escorting them home, usually there's something going on. I would assume either anxiety or depression. Those are the most
right.
common. It's not common to have a full mental break. That was very strange.
Wow.
And like there
I
was a lot of stuff that led up to it. But yeah, that was definitely one of them. I had another one where we had been working with this elder for months to try and help with his problems. And it seemed like it was going well for a month, and then I got a call at 5 a.m. and I was like so tired. But he called and he was just in tears telling me about how much pain he was in.
Yeah.
And I called the mission president, was like, he can't stay, like he needs to go.
Time to go.
And they sent him home and he passed away a month later, and I think about that a lot. Um, so there are cases sometimes. It's still up to the mission president, but I feel like my mission president was a really good guy, my first one, and he really tried to like balance that some missionaries just really want to stay out there even when
Hmm.
they have health problems, and other ones like you need to go home.
Yeah.
And he tried to balance that, and I have a lot of respect. He passed away a few years ago, but I still have a lot of respect for him. Um, we'll not talk about my second mission president.
Yeah, no, there are some really good people out there. Again, it's roulette, and there are some really good people out there that make quite an impact. What were you going to say, Landon? I did not serve a mission. You did. You can probably speak to this. these
I was
issues.
just looking up because you said there was one area, was it a mental health or just area health representative for all of South America?
Yeah, area mental health advisor.
There's 67 missions in South America. So
Yeah.
that is that is not much coverage. One
No.
person for you've got what, about 180 missionaries in a mission?
Yeah,
Um,
there were about, I can't remember how many. I think I had 170 in my mission alone.
yeah,
So,
that's about what I remember. So I mean that's 10,000, 11,000 missionaries with
yes,
one mental health advisor, and I think we all know that there's a lot of in fact we had somebody tell us, I can't remember what the percentage she said. We talked to, I think she was an area medical missionary, and she told us it was a large number, like 15% or something of missionaries were going home
oh yeah.
on mental
Mental
health
illness.
issues.
Yeah.
Were you seeing that, or what were you seeing? And was most of the reasons going home health related, or were they mental conditions? And I know a lot of times they come home saying it's a medical condition, but it's really was more of a
It's a
Right.
significant number. Yeah.
depression. Yeah.
Yeah, it's funny. So we when I was getting ready to leave on my mission, it since I lived close to church headquarters, they do a 1 day, I think it's a 2 day training for Mary for the doctors, but I only went to 1 day. So they do like a little training for all the the AMAs, the AMHAs, and the mission nurses who are like in the area. And you go and they like share you like they basically give you like a little primer. And not all like mission nurse specialists will get this. It's just the ones who live close. But they give you like a little primer on things, and one of the presentations they give you is actually statistics because like the church loves numbers. They track like everything, like
They
every
do. They don't
possible facet.
necessarily let us know the
They
numbers,
don't
but
tell
we
you.
No.
know they have the numbers. That's what's so frustrating.
I know it was the one presentation that I was like so honed in on because I was like, I love numbers too. And they were telling us such fascinating statistics. But it was also the one presentation that I never got a hold of, and I still hate that because it was the one that I really wanted. But yeah, I'm pretty sure they just don't want the numbers floating around. But it was I like the one statistic, like this is 10 years ago now, so I could be
Mhm.
wrong, but the one statistic I remember was that well, there were several. First, missionaries who are from the United States who serve in foreign missions would go home at much higher rates than like missionaries who were like from that area. Um,
I can see that.
and then a huge significant portion of them would go home for, I wanted to say it was like, I feel like it was in the 30s or 40% of them that would go home for like physical problems. Now I'm getting my numbers mixed up. Okay. So it was like 30, like high 30s, low 40s of American missionaries serving foreign missions would go home versus like low 30s to high 20s of like the local area missionaries that would go home early for medical issues. And then of those missionaries that would go home, for like health, like physical health problems, like a majority of them would recover spontaneously in like the following months afterwards.
Yeah.
Because like mental health is very closely tied to physical health. So if
Yep.
you are under a lot of stress, you are probably going to have a lot of physical stress too. And it was just such a fascinating statistic. I just remember being like, okay, so most of them are going home. And like they did emphasize that it wasn't they were trying to get out of the mission. It's just like the stress was so much like so badly that it was causing physical symptoms.
Yep.
And they were going home because of that. So they do have all the numbers. They track everything and they follow up with the missionaries afterwards so they can contribute to their numbers to know how many are spontaneously like healing afterwards. So they can assume what the mental health impact is. And it is very significant. I had, let's see, I had multiple missionaries who went home early, or should have gone home early because of mental health issues. Some of them were in my house. I would occasionally get paired with missionaries with like severe health problems. Like one of them like popped her knee out, so she couldn't walk for a
Oh,
whole
wow.
change.
That's not going to
So
work.
I was like, well, we don't walk a lot in my companionship because I'm usually on my phone. So I guess you're paired with me for 3 months. Sorry. So I had some of those. I had other missionaries that I was pretty sure that the mental health was contributing to their physical health problems. So they would get paired in my house too, and we would just do interchange like exchanges because there would be two missionary companionships in there. So I would stay with the sick missionary while the other ones would go out. Yeah, so it was a whole thing. It's pretty
Well,
common.
Yeah.
was that concerning as a healthcare professional when you go 30 to 40% of missionaries are going home and you look at what percentage of young adults would normally have, conditions that would cause them to go to go home from a school
Right. Or just
uh,
not participate in
or
life or have to
something
duck
else.
out
Yeah,
or
that
yeah.
there's that many leaving, and what did it ever did was there ever a question of what's contributing to this, or why is this happening? They're supposed to be teaching the gospel and be extremely happy, and yet they seem to be depressed. Was there any attempt to find out why so many were experiencing this?
I'm trying to remember, and like those numbers, I absolutely could be misinterpreting them. I know it was a significant, it was enough that I was like,
No,
oh, that's
that
concerning.
number tracks with the mission nurse that we actually just met at a post-Mormon outing probably
Perfect.
about a
Okay.
year
I
ago.
remember
And
incorrectly.
she said, of course, we said, would you ever want to go on a podcast? And she wasn't ready to do it, but she
Okay.
said she was in charge of, like you described, an area. It was like several different things. And she quoted us pretty much those exact
I think it was
statistics.
40%, she
Yeah,
said.
40,
Yeah.
which we were stunned. We said, are you saying what we asked her several times to clarify because we couldn't believe it. So no, I think you're right on because
Okay.
that's what this
I was
person
like, oh
said
my gosh,
too.
my memory
Yeah,
might
no,
be
she
really
didn't want
bad.
to
But I
come and
remember it was
yeah,
30% of
yep,
30 to 40% of something, and the American
yep,
missionaries had a higher number than the other missionaries.
yep. And
So,
she
and it was
specifically
weird.
said, medical reason on their chart,
Yes,
but then it's not. Yeah, I mean, it is, like you
it
said, but
is. Yes.
precipitated and it's a result of a severe, whatever's happening, depression or whatever.
Yeah,
So
and I had a lot of missionaries that had like actual like not actual because like sorry, I shouldn't say that because mental health is an actual thing. But I had
right.
missionaries who had like they blew out their knee or they broke their
Yeah.
meniscus in their knee. Like yeah, like go home. This is a
Yeah.
walking mission. You cannot walk here.
Yeah.
But I had a lot of missionaries who had their primary chief complaint in like medical terms was mental health symptoms.
Mm-hmm.
It was concerning. So a little bit of background on just my journey in the church. As part of my preparations for going on my mission, I delved very deep into church history, and that was when I started going like, oh my gosh, do I go on my mission? Do I even stay Mormon? So I went on my mission as someone who probably shouldn't have, but I wanted to go so badly because I was like, I'm going as a nurse. Like, there's got
Mm-hmm.
to be someone like some good that I can do as a mission nurse. So I I went as someone who was like halfway out of the church already. So when I was looking at these numbers, they were just fascinating, and it didn't like challenge my like belief that much because that belief was already kind of going out the window. But it
You
did make me be
confirmed what
like,
you
I
were already
really,
thinking. I knew it.
I was like, oh gosh.
And it's probably truth claims that are driving everybody nuts.
Yeah,
Yep.
I
No,
was
I
like,
get
oh
it. Wow. What an
no.
interesting scenario to be in.
It was very interesting. Because then I would like look at like how hard some of these missionaries were pushing themselves, and I was
Yeah.
like, you were like literally destroying yourself. Like you're destroying your body and possibly giving yourself like some serious mental health issues by
Mm-hmm.
how much you were just like, oh, like drinking the Kool-Aid, I guess. I felt
Yeah.
like so bad that I couldn't just be like, no, stop it. Like believe less, maybe. Like take a break,
Believe
go
less.
sleep.
That's a
Like
great
stop holding yourself to
prescription.
these
Believe
standards.
less. Yeah, you're okay.
Oh my gosh. I did actually like prescribe, quote unquote, prescribe rest so many times. And I would say 9 out of 10 missionaries did not listen to me.
Well, no, because that's seen as a sign of weakness. Like I
Yeah.
said, I've had
Yes.
missionaries and I'd go, just can you like to no, that is the adversary. That's a sign of weakness. I've got to keep going. If it kills me,
Yeah.
literally,
Yeah.
they're so in it that they don't even really care if that would be the end result. So yeah,
Yeah.
it's a
And they're
really
taught that like
interesting
if they sacrifice that they'll be blessed. And it's
exactly.
like, oh,
Yep.
or you could rest and feel better in like 2 days and, not have like debilitating
Yeah.
problems for the rest of
Well,
your
Well,
mission.
I think the hard part is that you're told, that if you're faithful and you obey the rules, that you'll have success.
Right.
And maybe South America was different, but we'd go out and we'd have zero. I mean, you'd be lucky to place 2 Book of Mormons a month, and you're just going
Well, you were
around
in
going,
Indiana.
"Is
That
it
is
me?
hard ass.
South America is
Yeah."
very different, yes.
Well, you're sitting there going, am I doing something wrong? And you start putting the blame on yourself
Mhm.
when it's really the message that nobody wants to hear. It has nothing to do with you, but you take that rejection as if you're doing something wrong. And I know, I mean, when I went in the '80s, I believe the 40% number because everybody had mental, we're struggling mentally. How do I, because you can't just knock doors and not ever get in for months on end, and you start fading into some other, you start living a different life in your head just to get out of, I'm just walking around knocking on doors day after day, with not accomplishing anything. And that played on your mind. I know for me, it was very difficult, but in the '80s, you never went home.
There was no such thing as mental health in the 80s.
Yeah,
Yeah.
yeah.
I
If
mean,
you
like
went
that, but
home,
it's
you
interesting
were.
you would say that because I saw a comment on one of these threads where the person said, I developed a habit of daydreaming, living something else in my head just while we're walking and walking and walking. And I would do that for hours a day. And the person said that developed into a disassociative kind of a
I believe it.
scenario. And then
Yeah.
that just spiraled them into more lifelong mental health problems. And that sounds like what you're saying, just kind of living in a fantasy about what you would do later or what could be different, or I'm trying to picture how that would be.
I kind of pictured what's my life going to be like once I get off my mission
So like
because
fantasizing about
I
the
had to
future.
I had to live my life somehow. So it was okay. When I get home, I'm going to do this. I'm going to do
Mhm.
this, and then you'd play it out in your head and all of
Mhm.
that, and you'd come up with all these ideas of how you were going to become a millionaire or whatever. But you had to live life outside your head because it
Right.
was just so boring, so monotonous every day. And some people's good. We had this discussion. Is that destroying your mental health or is it making it stronger? And I kind of said, if I ended up in the Hanoi Hilton and was, shot down in the
Like
Vietnam
a
War and had to live
POW.
a POW, I kind of went, well, I maybe could make it now because I've
Oh
had
my,
2 years of living in my head,
that's terrible though.
But
that's,
so
that's
so
how
at one
bad
end,
it was.
were you strengthened or were you weakened? I don't know.
Yeah.
I always kind of question that, but you could see it both ways, I guess.
Yeah.
So how many
I
missionaries would you
think about
say
that.
were in like counseling? Because I have enough, nieces and nephews and friends, and
Ooh.
that it seems like almost all of them are talking to a mission counselor like on a regular basis. I mean, is this the thing? Is this what happens? You go out and then you connect with a counselor who tries to help you, recover to stay, or
Yeah, I would say so since I was in South American mission, just kind of circling back a little bit, it is different in the States. A lot of times the mission nurse is someone who lives in the ward and that's their calling in the ward is to be the mission nurse there. Just again, there's not a whole lot of mission nurses, so you kind of have to do with what we can. So it would be very different in the States. In South America, the only mental health advisor, like mental health resource we had was that mental health advisor. And based on what I read in the medical charts, there were a pretty significant amount of missionaries who were talking to her at least like once a month or every other
Hmm.
week. Um, and honestly, a lot of them just hid their symptoms. And I would just hear about them from the grapevine and be like, well, that's concerning, but I can't force you to like talk to me or the mental health advisor. So I guess that's great. Like I didn't even talk to the mental health advisor about my own problems until literally like the last 2 months of my mission. When I was like, oh wow, I apparently have some mental health issues.
yeah.
Like this is not the environment for someone with ADHD and autism. Great, love it.
Well, and I think
So,
parents sometimes don't even recognize, now you have those phone calls home but you just kind of have this trusting sense that everything is okay. And I remember one scenario, I'll try to be really vague, where a family member told it was an amusing story about her missionary had done something that was so weird, but
Huh.
funny. And I recognized it right away as a self-harm kind of a thing.
Oh no.
It
Yeah.
wasn't funny. They were taking it as quirky. I'm like, no, no, that is actually so quirky that's not funny, but they didn't see it that way. They were just like, and I thought, oh my goodness, I was really concerned about this person for a while until finally the family started to recognize, because it escalated. But sometimes people don't know, even on the home front, what to look for, a
Oh
strange
yeah.
behavior or a quirkiness or a self-harm inclination that manifests itself in a way that you're not looking for it. You think you're on a mission. You're fine, right?
Yeah,
You've
like
got
their God
everyone
will protect
around
them.
you.
It's
You're
fine.
fine. Yeah, exactly. So I think it's
Yeah,
better
I
now than it used to be. I think that, awareness has got to be going up. Too many people are coming home. People are talking. People are being vocal. Parents are being vocal. That, I would think awareness is going up about those scenarios. But look at the couple posts we all just saw, really serious, of kids, really taking it to the attempting that final step, which is just heartbreaking.
oh yeah. Yeah, I had right before I got on my mission, there was a case of a elder who I was kind of familiarizing myself with the medical charting system, so and like seeing like what missionaries were dealing with, so I could be prepared. And there was one particular case that I'll be very vague with, but it was like reading a Hollywood script about how far this case had gotten, and I was like, this is horrifying, like that he's resorting to these methods
Yeah.
because of whatever, like I don't know what the reason was, like if he had like a mental health issue before the mission and he just came and got it. Because one thing that I saw was really common was missionaries would lie about their mental health diagnoses so they could actually go on the mission,
Yeah.
and then they would be like, hey, I need a prescription, and they'd send me their prescription. I'm like, this is a controlled substance for a mental health like thing, I can't give
Serious.
this to you. It's on
Yeah.
our list of you can't be on a mission.
Oh my
So
goodness.
we had to send some of those home. That was great.
Yeah, I feel
Um,
like bishops and parents sometimes push that through too. You know what? You're going to be fine once you get out there. Nobody
yeah.
needs to know your past or anything like that. And then you hear about the missionaries who fantasize about ways to kind of hurt themselves to get home. You know what
Oh
I
yeah.
mean? And once it gets, what if I just were to break my leg? Or when you're in that scenario, that is really dangerous, I think.
Yeah. And they're all in every mission, there's always at least one missionary that I think even if they don't go through it, there's always at least some that are thinking it. And it's like it's, especially with the elders, you don't want to ever admit it because then it's a weakness because you
Exactly.
have to be like manly and also
Yep.
like spiritual and a priesthood holder and you can't think that thing. Um I don't know, sometimes I wondered. I also had a lot of missionaries that were very closeted LGBT, and I later found out I was one of them, so that was great. And it was very interesting comparing to how they were on the mission versus how I knew them after the mission because I met a lot of them afterwards, and I was like, "Oh, you're not Mormon either. That's great." And you're LGBT
Hey,
too.
hey.
That's awesome. I'm glad you're living your life. And I was like, "Wow, that explains why I had very weird vibes about you."
Oh,
You
but
were
that's a happy ending. If you're seeing people and they've recovered and they're
so happy.
trying to live their authentic life, that's got to make you happy that they survived that environment.
It
But
makes me so happy to see them embracing like who they are, away from an environment that does not want them to be like that. I am one of those people that left and was like, oh wow, I'm also LGBT. Crazy. That explains why I never fit in. Awesome. And it's nice. It's heartening to see people who survive and can get out and it is a huge lift to your mental health to be able to like be authentic and not feel like you're
Mhm.
failing at every part of your life because you don't fit in this perfect box. Um, I can't imagine how hard it was for a lot of those missionaries who were closeted and were then completed their 2 years. Since I was just a sister missionary, I just had to do the 18 months, but wow, that's so much. And then to come home and be like, oh, now you gotta get married. And it's like, oh, yeah, but I'm gay. Like,
Oops.
oh,
You,
it's
you
like,
know,
oh,
I,
gosh.
I think you may have just, to me, you may have just nailed the problem why there's so many mental health issues is because you can't be authentic when you're on a mission. You were
Yeah.
told that you must act this way, you must be a spiritual person, you must act like you want to sell the gospel, you want to, the Book of Mormon's the most important thing in your life. Most people are not salesmen. They don't enjoy doing that kind of work. They're not, that religious zealot that they have to be for 2 years. And so I think maybe it doesn't matter whether you're LGBTQ or just you're being a missionary and you're not really that spiritual giant that they're trying to make you pretend to be. You're pretended to be something you're not.
Yeah.
And I think that drives people, that has a mental health effect on you.
Oh yeah, I definitely think you're right. Because and even in my case where like I did not have mental health diagnoses, like late after the mission, I was diagnosed with like ADHD and autism and general anxiety disorder. And a mission is like the worst place for like that combination.
Yeah.
Where like I like having like an agenda, but their agenda was like there was no downtime and I need
Right.
downtime. And oh my God. And then, of course, with the general anxiety disorder, like talking to strangers was literally traumatizing. So traumatizing. You have to do that every day for 18
Yeah.
months. And you kind of, it is kind of like you get conditioned to ignore those feelings, but then they're still there and then they keep building up. And then eventually, like, oh, that's a lot of missionaries would just like break down. And it's like, yeah,
Wow.
because you don't have time to just like feel. You can only feel what the mission wants you to feel, which is like the spirit or however you would interpret that. You just have to feel very spiritual all the time. And every minute of your life is dictated. And it's just so mentally and emotionally exhausting. So it's not a surprise. I know when they were giving us the numbers and that training that they did allude that the reason that they were like, well, like a lot of American missionaries are like used to a higher standard of living. That's why they're going home at higher rates. Um, it seemed like they were alluding to that they kind of knew that the mission is kind of a hostile environment for a lot of people, and that was why a lot of people were going home early because it's just not conducive to like a healthy mental health.
And yet they keep sending them, and
They
they
do.
have for decades. And I have stories that go back decades of really serious mental health issues from friends and kids of friends. And I dated a guy at BYU whose companion had ended his life.
Oh.
And the guy I was dating on the mission, the guy I was dating, of course, was the one that found him because
Oh,
he's the companion,
yeah.
and he still, as you can imagine,
Oh, yeah.
had trauma. I mean, I don't know if he does now, decades later, but he certainly did then. But the idea, and I was like, what happened? And he's like, I don't know. We just went on just the work, and I'm
Yeah.
like, are you serious? You have that kind of an experience and you're not going to take a few weeks to try to wrap your brain around it or process, but no, nope. You're just going to move forward on the work. And so it's just incomprehensible to me that they know the statistics, they know the problems, they know the environment is hurting these children, and I say children because they're freaking 18 years old, 19. They are very young. And it's not just for the mission, like, oh, and now I'm better. We've interviewed people on our podcast where it's decades later. Some struggle for decades, others start struggling in a decade or so and don't know what it is. And it's from the mission. I mean, these are huge problems and multiple problems, and so many people. Why? I'm on the soapbox, but again,
Yeah.
why not just send people on a mission trip to build a school or something? Can you imagine? And if you happen to talk to someone, then you might tell them about your religion, but you're doing work and you're doing service and you're doing good and you're with, people that are from your religion. Why not do that? Can you imagine that environment? I
I
think
would
Landon and I
love
have
that.
talked about this. That
I
would
probably
be
would still be
amazing.
Mormon
Wouldn't
if
that be
that was a
amazing?
thing.
I know. Because you may not have converted anybody like poor Landon in Indiana, but you've done something, right? You've experienced things, you've met people. I just don't know why it has to be this environment of this endless trudging and pacing and knocking. None of that works. None of it.
It would be interesting to compare numbers against people who go on these, a Baptist mission to build a house and they go
Mhm.
for a month and
Mhm.
help, in Haiti or something, do you think 40% of those people are coming home?
Yeah.
Or,
I imagine
because,
not.
No,
yeah, because they're
because they're
actually doing
authentic
something and
and
it's
they're
not
authentic.
long term
Yep.
and they don't tell you you have to act a certain way when you're there,
Yep.
you're just there to do your job. Did you ever have injuries where somebody, where they injured themselves while doing their missionary work? Was there ever
Yeah.
we need to call Curtin McConkie first thing as
Oh,
a
good question.
protection against the church that the church could be liable for this injury? Or did you ever see any of that happen?
I fortunately did not. That's not to say it possibly didn't happen, and I just wasn't aware of it. I did have missionaries injure themselves on their mission. There were bike areas of the mission, and
Oh,
I
I
had some
bet.
really gruesome knee injuries from bikes.
Right.
I had an incident where, and anyone who went on my mission will absolutely know who I am based on this story, but I had one incident where companion stabbed his companion. It was an accident. They were sword fighting with broken broom handles, and one of them didn't parry fast enough, and he severed a tendon in the other elder's hand, and it was like 10 p.m. at night, and they were 2 hours away from the nearest hospital that could put it back, and I was like, I don't think any legal thing came out of that. There could have been where like so and so stabbed me. I never had to deal with the legal stuff. I don't think we had any training about it. But the church has really good lawyers and a really good lawyer system, so if they needed to, I'm sure they could.
I'm
We
sure
did
they
have
could.
different insurance outside of the US, and we were told specifically, like we had dedicated insurance people to call in that company. So we had a dedicated line that we would call them. So I would assume if anything got called through that line, then it would go wherever liability stuff
Mm.
went. That wasn't my thing.
For a minute, I thought you were going to tell the stabbing story that happened in my area,
Oh,
and but that was on purpose. And
oh,
the person whose friends the son this was like called the leaders like he tried to stab me. And they're like, get him in the bathroom, shut the door, and we'll be there in a couple hours.
yeah,
And
couple
it's like
hours.
obviously the kid needs is having a breakdown and needs some
Yeah,
help, and the other kid is like, he's trying to kill. I mean,
yeah, he's by
seriously, you
himself
almost want to say, I
usually.
didn't sign up for this. I didn't sign up for that.
Yeah, there were some mission companions that I was like, this
Yeah,
is bad. Yeah,
it can
like
be volatile.
when that one missionary had her mental breakdown, like her poor companion just had no idea what to do. And I was like, yeah, that's fair.
Yeah,
It's not something you see every day.
no, totally fair. Did you see, and this is more serious, like, did you guys deal with any kind of sexual assault, or did you have training for that in case that would have happened? I mean, we do hear about that kind of thing that sometimes
Yeah.
happens, and we wonder about the care that some of these kids are getting if something happens.
I luckily didn't have any of that. Again, it could have happened and I just wasn't aware of it. It didn't ever come through me though. I'm trying to remember if we had any training. I don't think we did. And in all of my
Yeah.
documents, I don't think we had anything from the area medical advisor that talked about it.
Talked about that. Yeah,
Um,
I've heard that
yeah.
too. And yet you hear when something like that does happen that it just seems crazy. Like, here, go sit in the stake center and you can't call your parents and we'll get someone to come talk to you. You're like, there
Yeah.
needs to be protocol for that, because I can imagine, especially with sister missionaries, that's a that's a likely possibility in some places,
Oh yeah, especially where like some of the areas I was in and some of the
Yeah.
areas we would go into in those areas, like super dark, no, there's like nowhere to
Yeah.
go. You're in these back roads in these tiny areas. Like I know and like typically the elders were put in the quote unquote more dangerous areas, and yeah, they saw some stuff. I mean, I got mugged in the street. That was fun.
Oh.
And I was in a safe area.
Oh my gosh.
So they and some of the stories the elders would tell me, I was like, "Excuse me, what? You saw what
How?
happened?" So it blows my mind that like it would tell me these stories, and I was like, "You shouldn't be in this area. Like you got robbed at gunpoint. Like
Yeah.
what's happening here? Like we should be more concerned about this." But there just wasn't a whole lot of like, at least not on my end, because I wasn't aware of any policy that we had. I'm hoping that the mission office had a policy for that, but I was not communicated it. So that's why I'm gonna assume there's probably something like higher level up in the mission
Yeah.
health department for when because I assume it would have to go to the mission president. It probably would go to like the zone leader slash APs, and then they would take it to the mission president and he would deal with it. Which is what happened with like some of the really serious health problems we had. So I thankfully never had to personally deal with it because I would have taken a bus to some of those places.
Yeah,
Be
no,
like, oh, we are taking care of this right now.
So
So,
were you allowed to do any hands-on stuff, any examinations, any, if somebody came and I mean, an elder has a rash on his butt, could he show that to you, or did you have to say go to the doctor? I mean, did they look at you as a professional, or did they look at you more as a sister missionary, and it was more important that you not have any kind of contact like that?
um, I, hmm, I did do some medical stuff. It wasn't like anything super invasive like that, but I did do some stuff that we later realized I did not have permission to do because it was like actual medical stuff. In terms of examinations, if it was an elder and it was something like particularly private, that we just sent them to the doctors that I had lined up, like the clinics I'd lined up everywhere. For some of the sister missionaries, I did do examinations, and mostly I did the examinations so I could either relay it to the doctor I had there in the country or to the area medical advisor so he could tell us like what we were allowed to do about it. Um, so like I had one case where a sister missionary had a lump in her breast, and we were trying to figure out like, is this like, are we worried? Is this cancer? And so I did an examination. We were talking about some other things, and then we realized that she had a birth control implant, and a common side effect of birth control implants is lipomas that just randomly appear. And that area medical there was an area medical advisor at the time who like specialized in women's health. So he was like, it's this is what it is. And he's like, we can do the testing, but if it's not growing, if it's not showing other symptoms, then like we should be fine. So it was kind of a mixture. I would occasionally have elders who would ask me to like help a member, which I technically was not supposed to be doing because again, I'm not a medical professional in that country. I'm just a volunteer. But it's hard to say no to that. So like if I could do good, then I would try to. But I couldn't do like anything super invasive because I'm just an advisor, just a specialist.
just it makes you realize all my kids went stateside. I guess I should be so glad because
It's
any medical
crazy.
care they needed, it was right away. They could go to Instacare, they could talk to the mission doctor, they could get an appointment, and there was all this infrastructure for somebody stateside. And it sounds like it's very different somewhere else, which makes sense.
Oh yeah. I had one missionary who was sick the entire mission. We couldn't figure it out. We sent her to the best hospital that was there. We tried to do all the testing. She came home and got like diagnosed in like 2 months in the United
Yeah.
States. And she suffered
Yeah.
for 18 months with this diagnosis we could have gotten in the United States in like a matter of weeks. And that was very common. They do have socialized medicine there, so it was like pretty easy to just walk into a clinic, but the standard of care between the basic clinics and like the private care clinics were very, very different. I have some really weird stories about that where I was like, they let you do what?
With who? With where?
With where, like what? They told you to do you did what? And I was very concerned. But yeah. I don't know. It's very different, and of course, every mission in every country is going to be super different. So like sometimes I hear the stories from my roommate and their experiences also in South America, but a different country. And I would be like, wow, I don't know if I could have dealt with earthquakes every month on top of everything else.
Oh, yeah, no, that would not be good. Well, I just know that before my kids had gone out, I had heard enough stories of people ignoring either mental or physical issues or having their companions say, you don't need to call, anybody, you just need to pray harder or
Oh
I'll
yeah.
give you a blessing, all of that, and there were some outcomes where had they gotten help in a timely way, it would have been a better outcome. I had several stories of like that in a row. So when my kids went out, that was the number one thing I said. I go, if there's something wrong with you, you don't let anybody tell you that you just need to pray. You
Yep.
insist that you need to have a doctor look at you. You insist on that. I really drummed that into them, and they did that. But unfortunately, the reason I said that is because of stories prior to that where that didn't happen. The person, oh, if I just have more faith, my artery will stop bleeding. It's ridiculous, but that exists. I mean, it sounds like you had a really good mission president, so I'm guessing that probably wasn't the environment, but I'm sure you're probably aware of other missions and environments where that's it. You're not sick. Pray. It's the adversary, right?
Yeah.
It's Satan working on you.
My missionary president was really good. Unfortunately, one of the mission presidents before him was very much a stickler, letter of the law. If you're leaving your house a second late, the Holy Ghost has already left without you. Numbers are the most important thing. So there was still a lot of that culture that obviously was getting passed down by the trainers to the newer missionaries. So there were instances, again, when I would tell them, you just need to rest. You need to rest for one day. That's it. This will solve a lot of your problems if you just slept. But because that culture was still permeating, and our mission president did not agree with that culture, but it was really hard to change it especially when you come in so late into a mission, I don't know, years, I guess, because I can't remember how much they served, but he came in 2/3 of the way through or something.
Okay.
So he wasn't there for the whole time. Yeah, a lot of times they would just be oh, it's fine, I'll keep working, Hermana, because Hermana Rory, sister Rory.
The answer
and
is
I'd
work.
be no, stop working. And they would just be no,
down.
and I knew it was because they were I have to do this because God will bless me. And I was God will also bless you if you rest. But they couldn't get
God
past
rested.
that.
Yeah, God rested. He sure did.
Did you get anything cool? Did you have a red cross on your name tag, or did you get to wear an armband or
No, I
anything
didn't
that
get anything
identified
cool.
you?
I just got a cool smartphone.
Just a smartphone.
That's probably the best thing of all on a mission. Are you kidding? To be able to
It was
actually access an
so
app
nice.
or something? This is
It was unrestricted. I had unlimited data. They didn't have, I literally, the night I got there, the mission president took me to the mall with my companion and was okay, we'll get you a phone. And here's your phone. Here's the McDonald's. Okay, go to back to your area. And I was oh, that was easy.
Yeah, I was gonna say that sounds like a pretty good mission. That's
pretty
pretty nice. So
I
don't
really
know.
lucked out on my mission in terms of because man, if I'd had a different type of mission president, I don't know if I would have lasted. He luckily was very forgiving. He was just a very chill guy. Uh, ooh, man, yeah, it was a weird time. That 18 months, sometimes memories come back and I'm oh, wow.
Yeah, I'm sorry. We're not trying to trigger you, but
No, it's okay.
This is
I've been
so
trying to think
interesting,
about it. I actually read some of my old notes and I was
Oh,
oh, I
no.
had blocked out a lot of things.
Oh dear. That's how Landon was with his mission journal. We did an episode. We're wouldn't it be fun to go through your missionary notes and things? He's sure. And then after a couple of days of him reading it, it's I saw a change in you right away, right? Because you're reading it going, oh my God, look what happened to me. Look what they did to me. And yeah, I think that happens
I think
sometimes.
that's telling it also where a lot of us have blocked out most of our mission where we're I don't want to think about that. That was terrible.
Well, like I say, I wasn't really there when I was there. I was outside it in my mind, trying to be on the outside because it was so discouraging. So,
I can't even imagine.
And with you, they right away told you, because Landon's very funny. He has a great sense of humor. They right away said that, that's not the place for that here. We don't want you to, to do that or to try to interact that way. And, so right away they shut you down. They shut down major components of your personality and who you are. And that's really unhealthy.
There's that saying that the mission is more for the missionary than it is for converts. And it's true. They're basically brainwashing through trauma these kids to be lifelong members.
That's the tagline.
That is tagline.
Brainwashing through trauma. That's it. That's the new tagline. It should be on every name tag.
It is. It's literally you're just traumatizing them so much that the sunk cost fallacy becomes so deep that you're it has to be true because why else would I be out here? Why else would I put myself through this? And then they are more likely to become lifelong members. I mean, in my case, it did the opposite, and I'm sure in other people's cases, many of my friends who are no longer Mormon, it also did the opposite, but some of them stayed a lot longer than they otherwise would have because they went on a mission. So, yeah.
No, sunk cost is real. And it's funny because when I talk to a lot of different post-Mormons, especially the guys, If they ever go in and talk to a bishop, or they have to talk to somebody when they're thinking of leaving, they're always told, don't you remember your mission?
Oh yeah,
Of
all the
your
time.
mission. How can you turn your back on everything you knew on your mission? And
Yep.
that's it exactly. It's this intensive period of brainwashing. And so that's why they say, remember that. And most
Yeah,
of
but
them
only
are like,
remember the good
no, I
parts.
blocked it out. I don't want to remember it anymore. I'm too traumatized. But it's and think about how often they talk about their missions, especially like in elders quorum and stuff. It's
Oh
always on
yeah.
the mission. I'm like 50 years old on my mission. I don't know. It's this pivotal time, but so much goes so
Well,
wrong.
they also take away some of your coping mechanisms because, some people like I cope with I cope with stress uh, or when you're down with humor.
Mm-hmm.
And I'd get accused of being too trite or too light-minded
Mm-hmm.
for
Hmm.
the work. And you're going, no, this is how I cope. Other people working out, they want to go run 50 miles. Well, if your
Mm-hmm.
companion can't run 50 miles with he can go a half a mile. Your coping mechanism is taken from you because you can't do that. So people have different coping mechanisms that they're not allowed to use on their mission, and that's another reason why you see the high mental health issues that you see
Oh
on the
yeah.
mission.
Yeah, absolutely. Because I'm the same way where with my autism and ADHD, like I have to have coping techniques, and none of those were supposed to be available to me, but I had a smartphone, so I did actually have a couple. But one of my like number one coping techniques is I just need time alone, but you don't get that on
Hmm.
your mission. And so I was like always like I look back on that time period and I was like, oh wow, I was like always 1 second away from an emotional breakdown, like any like minor inconvenience, because I was always on edge because I never had a moment to just like decompress the whole
And
18 months.
sometimes you
Yeah.
just need a night off and go to the movies, but you're
Yeah.
not allowed to do that. You're not allowed to unwind or relax. You got to go back to your apartment and read Mormon doctrine for the next 2 hours and then go to bed. You don't get to go to a movie because you're going, man, I had a rough week. Let's go to the movie. You don't get to do that.
Yeah, and I think that's part of the structure of the mission of trying to like make lifelong members, where if all you are allowed to think of and do is this one thing, it does like shape your brain
Mhm.
and how you think
Mm-hmm.
about things if you do this for a long period of time. It's not a healthy way of doing it. A lot of us now have like whenever we think of the mission or like church, we have a lot of these like complicated feelings because we did go through a lot of trauma and our brains did get shaped in this way where we just associate it with like anxiety now because that was 2 years or 18 months or however long we served. Or even just, and this is the same with, like with any high cost religion, where they want to keep you so busy that you can't like think or feel anything that might lead you away from that path. And that is absolutely what that mission is for. It is very damaging psychology that works for that particular reason.
Yeah, I talked to a gal, and her father had been a general in the South Vietnamese army. And when the North Vietnamese took over, what they do? They sent him to a re-education camp, and that's
Hmm.
what they do. They send you for several years, and you're in that camp, and you're re-educated into the communist thinking, and you didn't get out until you walked the party line, and that
Yep.
was and a mission's very much that same way. They lock you down and control your thoughts, and after 2 years you come out uh, either broken or
Yeah.
or more
Or a company
more
man.
Yep.
yeah.
A
Yeah,
company man.
I think a mission like it either breaks you and you will eventually leave the church, or it will turn you into the perfect like member who is
Mhm.
willing to be a bishop or commit or be a Relief Society president because you've already given so much
Mhm.
on the mission. So like this should be easy. And then you don't think about yourself because you were taught for 18 months to 2 years not to. And that really screws people up.
No,
Well,
that
even
does.
if you're in the bishopric or a bishop, you still say, well, this is still better than that mission. I still get to go
Yes.
home, and I have a job, and I can go to the movies. So, even as much time as that consumes, it's not taking all of your time. So
Yeah.
it's
There's a
It's
reason
still
people
there.
have nightmares about their mission.
Oh
They
yeah.
do. They still have. And I didn't go on a mission. Like I said, I have nightmares about the temple because I only went like a few times at the beginning. It was so traumatizing to me that I still do have nightmares about that. But I don't know, Landon, have you ever had a nightmare about your mission? I've
Oh,
heard other
yeah.
people say that
Yeah,
they
I've
do all the
had,
time, or that they're called again. Maybe not
yes.
necessarily their mission, but oh my God, I'm going
Ugh.
back. It's just like, oh,
Yep, I've
the
had that several
nightmare.
times where I got, even after I left the church, I still had one where I thought I was being called back on a mission,
You're
and
like,
I was
oh,
going, no, no way.
you could just say
How do I
no.
get
You could
out of
just say
this?
no.
Oh, I
No.
haven't had one of those for a few years now. So they're
Yeah.
not usually nightmares. They're usually just like uncomfortable dreams where I wake
Yep.
Mhm.
up and I'm like, wait, am I on a
Yeah.
mission? Oh no,
I'm
I'm
not
not. I'm
on a
good.
mission.
I'm safe. I have a cat. It's okay.
That's right. I have a cat. Everything's good. Pet that cat. So,
Everything's
well, I
fine.
mean,
Maybe
I think,
instead of mission nurses, they should call mission cats and just have
oh my
a
gosh,
cat
can you
for each
imagine?
elder,
I would have
and
had a
then
much better mission with a cat.
Well, one of my missionaries did find a stray cat and they brought it in. I can't remember what they named it. It was like Elder Moroni or something. They gave it a name.
That's
They took care of
fantastic.
it for a while and then it got run over. So that was even more
Oh.
traumatic that that happened. But I have to say, the only thing I think is that with so many people coming home, at least the church is addressing it. You see their attempt at resources online. You see at least them telling everybody, be kind. You know what I mean? Just try to support this person, because I remember the first missionary I ever saw. Well, I have a whole story about somebody that I put in the MTC that ended up coming home, but that's a different story. But this story is when I had little kids and there was somebody in my ward, and he left on the mission to all this pomp and circumstance. This would have been 20 years ago, and all of a sudden, like a couple weeks later, he was back, and he was in the ward and he was on medication, and he looked like this. I mean, he had left just this like golden person, and he came back and he was just completely shut down. And I remember just thinking, what happened? What happened to him? Why? How did he leave? This hero, and he came back and he's completely beaten down. I had no idea what happened. He ended up going back out, and our ward was really supportive. Nobody said anything, but it was like the only person anybody had ever known that happened with. So at least now it's pretty common. When you hear, oh, so and so came back, you're like, oh, okay, what's he doing now? Is he okay? Is everything, I mean, do you see that a change in how people accept and understand?
There was definitely a push. So even 10 years ago when we were doing that training, there was we did talk about like the aftercare, like when
Mhm.
missionaries get sent home early.
Great question.
And we did actually have like there were, I know the mission presidents especially got like, it was only like a few handouts or a few pages in their like medical handbook, but it was still very much emphasized like make sure the missionary knows it's not their fault, like this doesn't mean they're any less worthy. It was more of an emphasis to try and counter that culture of judgment. Um, just kind of based, I haven't been in the church for a long time, but even just based back then, there definitely seemed to have been a shift in the past few decades of being less judgmental when missionaries come home. It definitely seems like I'm hoping nowadays it's a little different, because the mission people that were training us did address that you were less likely to be judged if you came home for a physical ailment versus a mental
Yeah.
health ailment. I am
Yep.
assuming that is still the case.
Yep.
Probably gotten better just because mental health has become more acceptable. But I'm assuming that bias is still there. And that was another thing that they addressed was like sometimes like a missionary will only agree to go home if they have like a physical illness because then
Yep.
they can prove quote unquote that they came home for a reason, like a good
Hmm.
reason. So there was still like, so luckily a lot of the missionaries that I had who had mental health issues, that had to go home for them, they still obviously because mental health issues, a lot of times you have that like severe lack of self-esteem and you're really hard on yourself. So some of them were really hard on themselves still, but there was still a very loving atmosphere around that, and there wasn't a whole lot of judgment if like a
Right.
missionary had to get transferred stateside because they just couldn't handle being in South America, which happened a few times.
Hmm.
Um, and I think I only ever had one missionary come back after going
Oh,
away. And that was for his meniscus. And we thought it was fine. And he came back, and I was out in a group with him, and he fell back to talk to me. And I let our companions go away. And this was one of the few times where, like, our companions kind of knew, like, oh, he's talking to the missioner. So we're going to just, like, let them talk for a second. And everyone could still see us. So it was fine. And he was telling me his symptoms, and I was like, Elder, you tore your meniscus again. You need to go
Oh,
home. And he was devastated. And I was like,
oh.
oh, just go home, dude.
Yeah, just go.
Like
It's
you're
not like
good.
Gordon B. Hinckley, whose dad said, the only way you're coming home off your mission is a pine box, right? Wasn't
Yeah.
it Hinckley, Landon, that wasn't it his parents that said
I
that?
can't remember, but
I think
that
so.
was a
But that was,
saying all the time when I was
yeah,
growing
better to
up,
come home in a
Yeah.
box. Yeah, I
and
think
that's
the attitude of parents changed finally. And they're like, no, no, the mental health of my child, life is long. We can work out whatever's happening. So your health and mental well-being is what's
well,
important.
and that's the sad part, and that's the other thing that adds to the mental illness is the fact that you have to explain why you're home.
Yeah.
Why
Is
Hmm.
can't you just say, you know what, I didn't like it. It wasn't for me, and I came home. But
that your fantasy, Landon?
that's
Think you
not an
wish you would have
option.
done that?
Oh,
Just go
I
home.
mean, if kids could just come home because they wanted to,
Yeah.
that there's a reason that they put that on you that you don't come home, and that's because if everyone would come home when they wanted to, they'd have no missionaries left. Everyone would
Oh yeah.
say this isn't worth it. You know,
Yeah. It's
you'd
not what
have
I
10 or
thought.
20% that would stay there, loving their mission. The rest would say this just isn't for me. I don't enjoy this.
Oh
So
yeah. Absolutely. I was one of the people that wanted to go home early. And it's funny because someone was mentioning on the Reddit that their parents didn't tell them that like someone had a health problem when they were on their mission
Yeah.
because their parents didn't
Yeah.
want them home. My parents did the exact same thing. My
Oh
dad
my
got
God.
cancer while I was gone. I didn't find out
Oh.
about this until after I got home. No one told me because they didn't want me because they knew that if I knew my dad was sick, I would board a plane immediately. So
Yep.
they just
Keep you
didn't
in the
tell
dark.
me. And
Wow.
that is so, and I was like mid-20s. I'm an adult with a bachelor's degree, choosing to be out here, and it blows my mind that it's just they prioritize you being out there than like your own well-being or your family's own well-being, and it's just so, it's like heartbreaking.
It is heartbreaking. And I've seen post after post after post of people saying, yeah, I couldn't go to my mom's funeral, or I had to stay out with my dad's. I mean, people pass away. Not only do they miss like weddings and events, we're talking last chance to see somebody in this life because this life is whatever, it's the next life, right? And
Oh
then
yeah.
if
Ugh,
they end up
hate that.
leaving the church, then that's a huge, just a huge regret and a huge problem. And they're usually in therapy forever trying to say, yeah, I miss saying goodbye to my mom. She was sick the last 3 months. You know, I've read all these posts. You cannot believe, as you said, how heartbreaking it is. So
Yeah, and it's something that's just normalized because yeah,
yeah.
everyone in the church, and this is something that honestly was one of the reasons that I got so disenfranchised was there was such a focus on the next life that
Mhm.
this life comes like you just don't value this life as much. And it's ugh, and especially on the mission, like you don't value those 18 months or 2 years, because you're just there for the church. You're there for God. You're there for these like other people and not really for yourself. Um, and I mean, it's a great brainwashing technique to
no.
get them to not think
It
about
is.
themselves ever.
Yeah, it is. So, what would you say as we're kind of wrapping up here? What is good advice? I don't know, to parents. I mean, a lot of us, even if we're post-Mormon, we have kids on missions, or we
Yeah.
have nieces and nephews on missions, or we're connected in some way. I mean, what can people do? I have to laugh. I gave my kids a code word. I
Oh,
said,
nice.
here's the code word. If you need to come home, I don't need to know why. I don't care, give me the code word and I will extricate you, you know, no, 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 no,
I will come
no,
and get
no,
you.
no, 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 no. Stateside 1 day, foreign, you know, this is before I knew where they were going, foreign
Mhm.
4 days. But no, you just say the word. And I know you can't always talk in front of your companion. You just fit the word in as you're, you know, saying whatever. And I, you know, but only use it extremely seriously, you know. And maybe that was more for me than them because everybody, you know, stayed out there. But I just, you know, how can parents or loved ones or friends just help support these missionaries who in a lot of ways are struggling? You know, it's a long 2 years and it can be
It
really
is so.
rough. Or what
Um,
can they look for? Like when I told you my story about
oh
seeing
yeah.
that where no other relative picked it up. And I'm like, I think that's a precursor to serious self-harm, what this kid
Hmm.
just did. You know, what to look for or what to know, or just how to be supportive long distance like that?
I think a lot of it starts even before the mission. A family that's not very open about mental health issues or makes fun of it, those missionaries are not going to feel comfortable talking about that. Um, so families that are more open about it to start with, kind of shows the kids like, yeah, okay, so like I like it, this is a real mental, like a real actual health problem, not just it's in my head and like I'll get over it and I can pray it away. It's like, no, a lot of times it's like a chemical imbalance or it's like different neurotransmitters. Like there's different things that are happening that is genetic or just not your fault. And sometimes it needs medications and sometimes it doesn't. So just being open about that and talking about that in a non-judgmental way, as same as like talking about missionaries who come home early. So a lot of this is like building blocks that start long before the mission of just showing that you as the parent or the family member will not ever judge someone who has those particular health problems, who has just even a rough time. And then also being able to like talk about your emotions and show them. Something that I noticed a lot about Mormons is like it's acceptable to show emotion if you're feeling the spirit,
Yeah,
but if it's something that's conflicting against that, then it's not so much acceptable.
great point. Yeah.
And I think it's so valuable to be able to talk about all of your emotions and ex and feel like you can express all of your emotions, no matter like there are no good or bad ones, but you know, the quote unquote bad emotions versus like the good ones. If they feel comfortable enough expressing those, they're more likely to communicate when they are in like jeopardy or like having real like a really hard time. Um, I know that's not always valuable, like it's not always something that everyone can do. I know a lot of times, like just in some of the most recent posts, it's like the aunts or the uncles who are like
Hmm.
looking at their nieces and nephews who are out and don't know how to reach out to them. And a lot of them are honestly doing what I would recommend anyway, is just keeping that line of communication open
Hmm.
and showing that they're not judgmental and not trying to like drag them or convince them to come out of the mission if they're not ready for it. Just like with anything in life, once like a lot of people, just people in general, do not like to admit they're wrong. They do not like to have that like they don't want to be wrong. So if you're approaching it as like, hey, the church is like bad and it's doing all this bad stuff for you, but they still believe in it, then it's just going to push them further away from you. So a lot of the people that are just trying to keep that communication open and non-judgmental, even if the missionary never takes that up while they're on the mission, a lot of times just knowing that there's someone out there who would listen, that does provide some relief, at least a little bit. It's just so hard with, because like at that age, you think you know everything and
Yeah.
you think
Of course
you
you
think you're
do.
smart. But then there are a lot of missionaries too who go on the mission and just are disassociating the whole time, but feel like
Yeah.
they can't go home.
Mm.
And that is just a case of, like in that case, usually it's the parents who are like convincing them to be out there,
Yeah.
or it's so hard in every situation. But basically, just keeping that line of communication open and being non-judgmental will help in some way, even if they do not take that offer or that option to leave the mission.
Yeah.
There's no perfect, unfortunately, there's no perfect answer, and each situation will be very different. But I'm such a proponent for like open communication and being able to have those people to talk to. That is how I talked myself to leave the church eventually, was I had people who were willing to listen, who weren't judgmental, who asked me questions that were non-judgmental but made me think and actually had to say things out loud to like support what I was believing. Um, and it was a long process, but it definitely helped me on my mission to have those people that I could just message and be like, wow, this is crazy. I need to like sanity check.
I need to process. That's right. It's
Yeah,
the
I need
fun
to
of being a
process stuff.
lifeline. Yeah, be the fun aunt that writes the letter that, says something nice and fun and supportive. And yeah, I love that. That's excellent, excellent advice. You're so good. You're so wise. You're so smart. Landon,
Yeah.
do you have any final questions? This has just been so, I think, helpful because people say, oh, you guys are post-Mormons. What do you care about missions? We care a lot. Most of us went on one, right? We have friends, we have family, we have children, we have siblings. We are connected to the missionary community and we're concerned and we want to help as much as we can.
Yeah. And like I became a nurse because I care very deeply about people. And I will say every time I see a missionary, like I wonder if they're okay. And like I wonder if they cry themselves asleep at night or if they are disassociating or if they're so like depressed that I should be calling I'm always nice to every missionary I meet because I know how hard it is and I know that there are so many out there who are just like struggling so badly and I feel so badly for every missionary that I meet because I don't know which ones are struggling because like they don't know who I am. They're not going to reach out
Yeah,
to me.
they're not going to open it.
And
Yeah.
that and I just want to like help them and I just want to like take them and be like it's okay. Like it's
Yeah.
okay that you're feeling let down or depressed or that you want to go home because this is such a stressful environment. And that's why and like even though I'm not a missionary, I'm not a Mormon anymore, I'm not a missionary, I'm not a mission nurse, like I just care. Like that's what makes me a nurse is that I just care about these people and I care about these kids and like my heart just breaks because I know I've heard so many stories of just people just being traumatized on their mission and just having like the worst time and the worst mental health and undiagnosed mental health and closeted LGBT kids who are trying to make it work and hating themselves every minute of it. And I just feel for them. And that's why I'm here talking
Hmm.
because if anything helps anyone, then it is absolutely worth it.
I feel like you ought to start a blog or something. Don't you think, Landon? Like, I'm not kidding. Something that, even just little pieces of what we talked about tonight, missionaries can access things now. They can be on Facebook.
It's true. Oh,
Oh, I
it's
feel like
crazy.
you might want to start some supportive postings or something, or I don't,
It's a good idea.
you
I
have
might do
really
that.
wise counsel for people that have missionaries and people that are on missions. So, Landon, do you have any final thoughts or questions for Rory? This has just been amazing.
Not a question. I guess, one concern when you say that there's one mental health counselor for all of South America and
Yeah.
Central America,
Yeah.
when you have a church that's the richest church in the world, has billions of dollars, can buy luxury resorts, but they can't hire a couple professionals to address the needs of the missionaries out there. That's a little concerning to me that, why don't you have 10 or 12 of these people instead of one for that? It's $1 million investment. You make that in 10 minutes, get the right people they need. It's clearly an issue when you have that many young people coming home because of mental health issues. Um, that needs to be dug into. What can we do to improve this number? And the answer is clear. Give them something productive to do. And I think, Rory, one of the reasons that you may not have had that kind of experience is because you actually were able to take something that you had, a skill,
Skill.
your
Yeah.
education, and you were putting it to use. I would have died to have been able to use something uh, a skill that I had. I had my private pilot's license. They could have had me
Oh,
flying
cool.
food around Africa or something,
That'd have
but
been awesome.
no, I'm
Instead,
I'm
they put you in Indiana.
instead
What
I'm
place?
walking around in
Seriously.
a farm country, knocking on
Seriously.
doors of Amish people. I
Oh
mean,
my
it's like I don't know what we're doing
So
here.
self-defeating.
But so giving you something to do, build a well, build a house, do something productive that you feel like you're doing something would go a long way towards improving the mental health. And the church has the resources to do that kind of stuff, yet they choose not to. They'd rather, it almost reminds me of Putin or the Russians in a war. They're in Ukraine and they've got so many human resources, they just throw people at the problem.
Mhm.
And, casualties are acceptable. We're willing to take large casualties to get our objective. And it seems that's kind of the way the church is doing this, is they're willing to take casualties, mental health casualties of young people in order to promote the faith and to get, like we said, the few strong
Yeah.
ones who are going to come out and be eternal LDS people because of it, but they're willing to have a 50% rejection rate and mental health issues. So,
Yeah, that's kind of what I arrived at too. Honestly, the collateral damage, they've crunched the numbers. They're like, for every 10 missionaries, we're going to get two that are lifelong committed church broke members. The rest of them, whatever, they can deal. I mean, seriously, do you think maybe they've crunched a number like that? That's the only explanation I can think of for this lack of resources, lack of personnel, lack of, and what I'm saying is individuals care. Your mission president really cared. Landon, you had one mission president that you liked. People on the ground care. Everybody has that. The mission secretary loved me. Or people are caring. I'm not saying it's the people. Saying it's the organizational structure. It's the corporate structure. The people are doing the best they can within that. It is the structure and the corporate side of it that is failing these missionaries. That's kind of how I feel.
Yeah. It's so funny that we're like talking just about like the one area mental health advisor for just South America, because actually when I was doing my training, there was a missionary couple that both of them were, one was the area medical advisor and the other was the area mental health advisor, and they were assigned to Russia, which I believe has 11 time zones. So the area medical advisor had half of Russia, and the area mental health advisor had all of Russia. So they were covering 11 time zones, both of them. And we were talking about it, and I was like, in Russia, the dark place, that
Yeah.
has like a lot of depression because
Yeah.
of the darkness, and you have one of you for the whole Russia. Yeah, it's I remember when I was like looking at those numbers, even back then, I was just like, oh, okay, so we are on our own. We're relying a lot on the resources that we build, and every mission is very different. Every mission president is very different, and it is just roulette, and you just have to hope that you can get things. And I am hoping, it's been 10 years. I'm hoping things have changed, but the church is very slow with change. And that's kind of what scares me. Maybe things have changed. Maybe things have gotten better. I'm not betting on it. So yeah, be nice to the missionaries when you see them. Some of them are just very, very, they've drunk the Kool-Aid. They're very into it. And a lot of them are probably going to leave eventually, but they will remember when you were nice to them. I remember everyone that was very nice to me. I try to be the same because I don't know what they're struggling with. So,
And that's the best advice ever. And I know that we see posts all the time in the post-Mormon community where they say, I'm helping the missionaries. I want to talk to them. I want to buy them something. They understand. They
yes.
absolutely understand the big picture of missionary work. And it's funny you would say that because I saw some elders at a Walmart checkout the other day. There were 3 of them. They were pretty super geeky looking, and I was just like, I mean, instead of going, oh, elders, it's kind of like my heart broke a little for him, because exactly what you said, I wondered, are they okay? Do they feel all right? Do they feel supported? Are they able to talk to anybody? I had that feeling, and I don't know, it's a vibe, a mother vibe. I don't know, just somebody that cares vibe. But yeah, I agree. That's the bottom line of this podcast. Be kind to the missionaries. Don't try to bash with them. Don't try to tell them anything. That just makes people double down. Just be kind, and you will sincerely do it. Obviously, who doesn't want to be kind to a kid in that situation? So
Yeah, they're kids that usually living on their own for the very first time. They have no
exactly.
other life experience.
Yep.
It's very scary, and it's very disheartening if you're knocking on doors in Indiana and you don't ever talk to anyone because no, or if you're in Salt Lake because everyone's Mormon here. So like,
That's right. And who knows, wherever you happen to be, it could be my missionary son that you're being nice to. So in an
exactly.
undisclosed location somewhere. But yeah, interesting. So, well, this has been fascinating. And you know what I just love, Landon, is that when we come across posts on Reddit and we connect with people that we have never met before, and we're just like, this person seems awesome. Let's have him on the podcast. Like, we've never been disappointed. We've always been blown away, just by how smart and articulate and caring and knowledgeable and wonderful everybody that we ever invite on is. And Rory is no different. This is just
Thank you.
amazing. We are so glad we connected. And we're so glad that when I said, would you ever come on a podcast? You're like, okay.
Yeah, sure, why not? I can do that. I've been on podcasts before. It's fine.
You have a lot to give, and I'm serious about coming up with some kind of platform where you could, just
nice.
reach out to people. Think about that.
That is why I've been on Reddit.
With your cat. Cats have great ideas.
My cat is the therapist. She will be the one that is giving all the good advice.
You know what? Her cute little face is therapy right there. I'm just saying, I know you don't feel it, Landon, but I'm like looking into those eyes. She's just so cute. Come on, Landon, look at the eyes. Are you looking at the eyes?
Yes, I'm looking at the eyes.
He's never going to understand the cat thing that I have here. So, well, this has been great. I hope everybody has learned something from this, and please comment. Let us know. Do you have a missionary out? Can you relate to this from experiences on your own mission? I think what Landon said, this is the topic where you might want to even start asking questions. Why aren't there more resources? Who can we talk to about more resources? There's plenty of money on the corporate side to give more support and infrastructure to our missionaries. So maybe it's time to start, not just reading the posts about things and saying, oh, that makes me mad, but trying to find a way that we can actually do something in some way, because I just don't think this can stand. And our kids are a great resource, and we want to help them, whether they're in the church, out of the church, whatever. Just, life is long. Let's live it and be happy. So please like and subscribe to Mormonish Podcast. And if you'd like to be made aware when new episodes come out, you can hit the notification bell. If you would like to make a donation to Mormonish, we have links in the show notes to Donor Box. We're a nonprofit, and we just appreciate all of you guys that do that. It really means everything to us. We have links to our merch store where you can pick up some fun Mormonish merch. And again, thank you so much, Landon, for co-hosting. And thank you, Rory, and your adorable cat. It was wonderful to have you on. We just appreciate it so much. And we will see everybody next time on Mormonish. Bye, everybody. I think the cat's waving.
Thanks for joining us for another episode of Mormonish. We really appreciate our listeners and would love to hear from you if you have a story you'd like to share. You can email us at mormonishpodcast@gmail.com. You can also find us on Facebook, Instagram, and on our website, mormonishpodcast.org. And don't forget to look for us on YouTube and like and subscribe. Keep joyful, everybody.